I'm Lauren, I'm a PTA at McLean County Orthopedics. We have a great ankle mobility video for you today. Just a reminder, this is not to diagnose anything. If you have any issues, please contact your MCO healthcare provider. So what we're going to do is look at the ankle mobility. A lot of people who maybe have some knee pain or hip pain, especially with sit to stands, walking, that's something they forget to look at. So this is a quick home assessment that you can do to check how your ankles are moving. So what we're going to do first is, if you have a wall, you can go into a half kneeling position, and what you're going to look at is the size of your fist, okay? So kind of get a rough estimate here and put your toe there. And for your ankle, you should be able to get your knee to touch that surface, keeping your heel down. Okay, that's kind of the rough estimate. You can check both sides. So I'm gonna have John come in and we're gonna look at his and go from there and see some things we can do to correct that. So John, if you wanna go into half kneeling, and we'll get the size of your fist. Perfect. Nice and tall, and let's try to get your knee all the way there. Yep. And one more, trying to keep that heel down. Great. And let's look at your other side. It's always good to compare sides. Size of his fist. And push forward. Is that a little harder on that side?
A little stiffer.
A little stiffer? Okay. So that'll be something he can continue to reassess at home, but we have some options if you can't get to the wall or to loosen up the calves that we can show you guys. So let's stand on up. Okay, so one of the things that John can do is use a foam roller at home for that area. Nice and easy to loosen up those muscles. And then we can also show you a stretch and an exercise on the step that we can do today. So John, if you want to stand up here. All right, and you can start by just dropping one heel just to do a stretch first. Lengthen all this tissue. We can do that on each side. Great. So he can do about 30 seconds on each side, but then we can also progress that into a heel raise. And you can even lift one side if you can and slowly lower to lengthen those tissues as well. If you have any pain with these, I would start with the light stretches and foam roll, and this would be more of a progressive exercise to do that. How's that feeling, John?
Pretty good.
Great. And again, you can do about 10 on each side. Don't work through pain if you have any. And then, so what we can also do to improve your ankle movement is when you're in that half kneeling position, John, you can just work repetitively on that motion. You can also have your foot on a stair so you have some support, especially if your balance is challenged, and work your ankle mobility in that way as well. Yep. And again, it's good to do both sides, and you can use the wall recheck as needed.